Hello, I'm going to go through this sheet with you so that you can download it and print it out, and I'll also be talking you through it here. So it's on your the lesson that you're looking at now, and this is my copy here. It makes it easier for me to look at it. And so this is the course that's introducing you to reflexology for your family. And there is an awful lot to learning reflexology, much more than you can learn in 5 segments or even 10 segments. I mean, it just is a big journey, but you will learn enough to be able to treat your family, which is the whole great thing. And I'll show you how a routine that you can use, and it's got words and pictures with it as well, so that, and I'll talk you through it so you can feel quite confident about what you're doing as you practice on your loved ones. So this is what we're going to talk about here: the power of touch, the benefits of reflexology, how the different systems of the body are helped by reflexology, contraindications, which is the cautions about whether to treat or not, and then the foot chart. So the power of touch is recognised now just how important that is, and that people thrive on being touched in a therapeutic way. It releases endorphins, releases the feel-good hormone, and they done studies with babies. They used to leave them when they were born poorly in their little cocoons and in the plastic and left them, and they weren't thriving, and they actually need touch to be able to thrive. And we're getting more and more being able to touch in this country, and that's a good thing. And it can, when somebody's there are some circumstances where talking to someone when they've been bereaved just isn't appropriate, but just a touch or a hug at the right time can be the thing that they need. And as it says there about a pet, they can lower blood pressure. So the benefits of reflexology, and Anne Galanders, who is mentioned here, she's written books and done foot charts, and she's a teacher of reflexology. And it's her method that I'm going to teach you. It's the thumb compression method. And she explains reflexology this way: that reflexology is a science which deals with the principle that there are reflexes in the hands and feet relative to all organs, functions, and parts of the human body. Applying pressure to these points can bring about amazing results. Reflexology relieves stress, normalizes function, balances the body, and relieves pain. Now, that is a big thing to say, isn't it? And it's almost a bonkers thing to say. And I still think it's mad, because how can working on someone's feet work the way it does? But it just does. It just does. So as it says there, that there are reflexes in the hands, feet and hands, and that includes as well the feet, hands, ears and the face have got reflexes. But say on the hand here, the reflexes, say the shoulder, which is here in the corner, that would be the shoulder reflex. Yeah, on your thumb here would be the brain reflex. So talking about reflexes is where the part of the foot or the hand or the ear or the face relates to an organ in the body. Up here we've got the lungs, that would be the lung reflex, you see. So she goes on to talk about the feet are the most neglected part of the body. We stuff our feet into shoes and they're out of sight, out of mind. But they actually contain more nerve endings than any other part of your body. And to to prove to yourself that that's true without actually sticking a pin in yourself, when you draw a bath or you want to get into a hot shower, you can feel it with your hand, and especially with the bath, you think, oh yeah, that's just right. And then you get in and find that it's actually too hot. So this is showing that your foot, because you've put your foot in to get in, ouch, foot comes out, and we've all done it. So that is proving just how sensitive the feet are. So reflexology can bring about deep relaxation, and it can affect you mentally and physically. You can help someone with their back. You can help someone to relieve their tension and their busy brain. It's an all-round good treatment. But it's more than just a simple foot massage, as you'll discover. There is a foot massage included with this package, but there's more to it than just massaging the foot. You're applying pressure on different parts of the foot, and that brings about a response to the corresponding part of the body. I know. One of the things that reflexology can do is boost your immune system, and that's really important, obviously, because we want to stay well. And what the reflexology is doing is fighting to get your body back to balance, because your body wants to balance. It's called homeostasis, and this is what reflexology will help your body to do. And by bringing someone into a relaxed state, excuse me, their body relaxes, and then the body can heal itself. Excuse me. So this next section goes into the different systems of their body and their relationship to reflexology. And we've got the circulatory system mentioned, respiratory, urinary, nervous system, endocrine, that's the hormones, lymphatic system, digestive system, muscular system. Every part of your body will be affected, because you're going to be working on the feet, which represent the whole body. So the skin, people have got eczema, people with asthma, people with arthritis. It can help everyone. It's not a miracle cure for everything, but it can help relieve the symptoms. Can definitely help reduce stress and help to give back the energy that you need. And it's a good preventative healthcare. So it's best not to wait until somebody's unwell. Give them the reflexology now. So it's for preventative. So who can have reflexology? Well, a newborn baby can have it, a 90-year-old looking for relief, a mother looking for breaks from the demands of her family, people that are coping with too much work, people that are coping with not enough work, sports people, teenagers coping with hormone, and people are on their feet all day long or not. And here there's a picture of a lion having reflexology by the look of it, which is totally mad, isn't it? So we're not going to claim to cure, and we don't diagnose, but we can help alleviate a lot of symptoms, and it has to be seen to be believed. So it's trying to receive homeostasis or balance of the body by working on your hands and feet. That's what it is. Now we're going to talk about contraindications. Reflexology is safe, but we need some common guidelines. It's best not to treat within an hour of if someone's had a heavy meal. And the reason for that is that the digestive system is then working to digest the meal. If you then start working on it's like going for a run after a heavy meal. Your blood starts circulating to the rest of your body, and you don't get so they might end up with bad digestion. It's not going to kill them, but it may not be very comfortable. If they've been drinking alcohol or non-prescribed drugs, it wouldn't be a good idea to start giving someone a treatment. If someone's extremely weak or clinically exhausted, I would leave it to a professional reflexologist. I don't honestly think you're going to do any harm, but and reflexology can work wonders with people with ME. But it's best not to work outside your area of expertise, isn't it? So don't work on scar tissue where it's a bit fresh. You don't work over varicose veins that are all wobbling up. You wouldn't work over them. The skin's too tender, thin. You wouldn't work over a bruise or an inflamed area. It's really using your sense, really. It says here about not treating within 12 months of major surgery or 6 months of minor surgery. That is a huge subject area, and it would be best normally to get, once the doctor's given them the okay, that they can start having treatments, and they've been signed off, then they can have treatments. But I would go by and take advice from a professional reflexologist. That's the best thing, because there are so many permutations with contraindications. But on the whole, you're not going to do any harm. Okay. It would be best not to treat in the early stages of pregnancy, simply because, and it's not because reflexology can cause a miscarriage, it's simply because if a miscarriage did occur, the mother would look back to think, oh, what did I do? Because they will blame themselves. And then if they went for treatment, they'll think, oh, I shouldn't have gone for treatment. And then you will feel awful. And it just makes for a not very good situation, particularly if they've got a history of miscarriages. Now, I've had many students over the years that have come who've had miscarriages in the past, and they've been having regular reflexology, and they've been working on each other in the classroom. They've got pregnant and carried to full term. So you cannot shift a baby when it's embedded in the mother, ready to grow, because you can't. The only precaution for you is to save the worry in case anything happened. So this is the one I did earlier. I'll make this a bit bigger so that you can see, this is the foot chart. Now, you've got a blank sheet for you to make your own chart. So you get your colouring pencils out and you can enjoy that. And I've made little videos where I've made this bit by bit, and you end up with your own foot chart. So this is the foot chart. And if you're looking at it as if someone's sitting in front of you with their feet up, then that's where their feet would be, isn't it? Their head would be in the middle where it says brain. And then the right foot is on your left. So that just makes it a bit tricky. But you see the shoulders down here that I pointed out earlier, down the side by the little toes, that's the shoulder area. You've got your lungs, which is the large area, and that's above the diaphragm. Your diaphragm is here where your chest is, up here. The diaphragm is a dome-shaped muscle that when you inhale, it flattens, and then it goes like this when you breathe in and out. And there's a lot of tension that can be held there. And so this diaphragm line is where that big blob is in the middle there. That's actually the solar plexus. And So by working along there, and I'll show you how to work along there, you can help tension. We've got the pituitary and all the brain hormones and glands up here in the toes. And down here on the right foot, you've got the liver shown. You've got the stomach. Can you see the kidney, the yellow, going down to the bladder? And this is an interesting one here. You see the large colon with it starts with a little brown spot on that foot on the right, and it goes up the green, ascending colon, over, across to the other foot, down and up. And that's the sigmoid colon, out to the outside world, near where the bladder is. And then you've also got here, it shows you where the spine is. The spine is on the side of the big toe. It's along there. So you can see that along there. It starts off at the coccyx at the bottom by your heel, and it works its way up to the cervix or the cervical at the top here. And on the side of the big toe, you've got on the inside there, you've got the uterus and the prostate, the testes and the ovaries. And on the outside, the side of your little toe, you've got the hip. So working all these areas is going to help the body and help your client. So there we are, a quick run through of the basic idea of what reflexology is about. We've looked at a foot chart, and you're going to make your own foot chart so that by the end of it, you'll have a very good idea what reflex is where the shoulder is, where the spine is, and that sort of thing. So well done for trying, I should say.